Good evening, everybody. I hope you're all doing really well and staying safe again in another week of quarantine. But we're so glad you could join us tonight for our In the Know webinar series. It's Tuesday night, and we're going to be meeting with Dr. Maryanne Senna. But first, I want to acknowledge a supporter of tonight's webinar. Scene Hair Care is a supporter of the organization, and we thank them so much for their generous support and help to make sure that this webinar is available tonight to all of our members and patients. And so now I'd like to introduce Dr. Maryanne Senna. She is going to be speaking tonight to us, what a real treat, on stress, handling stress, and the mind and body connection for those who are affected with scarring alopecia. Maryanne is the director of the MGH Hair Clinic at Mass General and assistant professor of dermatology at Harvard. So she is super qualified, a wonderful advocate for CARF, and a member of our board of directors. And so, Maryanne, thanks so much for joining us tonight and taking time out to talk with our members. Okay.
Jean,
you have the floor.
Always my pleasure, and thank you to Scene. They are wonderful. They actually, okay, Scene has been wonderful. They actually, we have discussed formulating a shampoo and conditioner that doesn't contain any potential allergens, which is something I'd like to talk to the group about at another time point, but really clean, wonderful product, great for people who are dealing with hair loss disorders. Can't say enough about them. So definitely check them out at Hello Scene, so HELLOSEEN.com. I have no financial conflicts of interest with them. They're just a great group, and I really believe in their product. So tonight I'm going to be talking about the stress and the mind-body connection and how it relates to something like cicatricial alopecia. And what's really funny about this is that these are real life shots from my actual life tonight. With my daughters, disclaimer, they're 5 and 8. They could end up screaming about not wanting to put on pajamas at any point during this webinar, so you'll have to forgive me for that. But I know many of you at home are dealing with this too. They can't see their friends anymore, so we're trying to do FaceTime play dates. You know, trying to get them to eat and like be on some sort of schedule. It's impossible. Never mind the mounting loads of laundry, which I don't know. I'm home now. Yes, I'm working from home, but why is the laundry not going away? It's still there. It's unbelievable. And I said to my husband tonight, you know, I can't believe I'm talking about stress and mindfulness because this is such a hard time for everybody. But I really do hope that I can give you some tips and some understanding of the implications of stress and the benefits of mindfulness that will motivate you to take better care of yourself. So the Cicatricial Alopecia Research Foundation, I'm sorry, I have to do a couple of slides as a shout out because, you know, over 3,000 people watched our last webinar. That's incredible, right? And if each person who watched donated just $20, that $20, we spend more money than that on ridiculousness, at least I do. That would provide CARF $60,000 towards research efforts. And all we hear from patients, I hear it in my clinic, I feel it in my soul. We hear it from you when we do surveys and questionnaires. We need clinical trials and we need research. Here's the problem, everybody. To pay for a research coordinator who's going to collect the data, put it into a database, schedule the patients to come in, make sure that the IRB, you know, all those things with the ethics committee at the hospital is met. They cost money. The cost of supplies, the biopsy tools, our professional photography, hair counts, the cost of medication or any other treatment we're going to try. If you do a study, you have to pay for those things. If I give someone a medication, their insurance might cover it as a prescription. But if it's in a study, the study has to pay for that. And a lot of patients don't understand that difference. There's laboratory technologies, so we can figure out what's causing this disease, what's happening in the hair follicle. There's so much we can do right now, but all of these things cost money. And so again, if each person who watched out of 3,000 donated just $20, it would give us $60,000 towards research. And that could provide at least two. And if we're really frugal and I'm not paying myself, and other people who are into this and are dedicated to this are just doing it to do it, we could have at least two really good clinical trials where we start to get real information on what's going on here. So please, if you feel like there's any value in these webinars, please go to www.carfinternational.org and make a donation. There is no donation too small. We are all struggling right now. There are so many people who are out of work or just, just scraping by or worried about what's coming next. $5, $10, $20, this has to be a grassroots effort. It's not going to happen without you, and I can't say that enough. So please consider that. I want to also talk about something that I'm super excited about. So the important thing to know about CARF is we are the only organization in the entire world that gives you medical information regarding scarring alopecia. The only one worldwide. I am so excited to be a board member. I'm so excited to be part of these webinars. It's an absolute delight for me, and it brings me a lot of joy to be able to connect with patients all over the country in this way. Our In the Know webinar series provide those of you who are battling scarring alopecia answers to your most pressing questions. These times are really strange and hard for all of us, but please, we are here for you, so show some love for us, please. So, as you may know, CARF launched their GEM Club earlier this month. The GEM Club is a way to give back to this organization that is giving so much to you. As a fun incentive, what I proposed is I will be hosting a private hour-long question and answer session with me that is limited to only 10 people. And this is reserved for people like you who join as GEM Club members by tomorrow evening at 8 p.m. Eastern Time at either the Ruby, Sapphire, or Diamond levels. And listen, if we get 20, if we get 30, I'll do 2. I'll do 3 of these. You get to ask me any question that you have one-on-one in a group of 10, and it's going to be awesome. I'm super pumped about it. It's going to be great. Please consider it. Tomorrow night, 8 p.m. Eastern Standard Time is the last time that this is going to be available ever. So I hope y'all take advantage of it because I think it's going to be a really fun way to connect with each other.
Dr. Senna,
I tell you about before we get into the crux of the
Wait,
what's that,
did I
Jean?
interrupt you? I just wanted to say that you are fantastic, and this organization is doing so much for the scarring alopecia community, and having you on our team and championing our cause is just so wonderful. And I hope the message is being received loud and clear that we are the organization for patients. We are here to make a difference in your lives, and we can only do it with the support and the help of our patients. So thank you so much for giving a plug for the GEM Club, and I hope we get a lot of people signed up.
Yeah, I mean, Jean, honestly, I am in academic medicine. I'm not here to make money. I'm not here to bamboozle people into spending thousands of dollars on things that don't work. I want people to have real information, but which is why I stand behind CARF, but also, you know, people need to, I think a lot of people just don't understand how much money and time and effort has to go into doing studies. And I think the only way that we can make this happen is with a grassroots effort. That's the only way it's going to get done. So I am just sick and tired of telling patients that I don't know what causes their diseases, and I think this is the best treatment, but I'm not sure because we don't have trials. It's unacceptable. We can do better. and we can do better together. The last thing before I get into my talk, and thank you all for bearing with me, is that first, I have an Instagram, Hair with Dr. Mare. I put it up here because in case you forget this website, we at Mass General with CARF have created an online hairdresser education. So it's a pre-test that's like 5 short questions, a 15-minute video, and then a post-test, and hairdressers can get a certificate of completion of this education course where they learn to recognize signs and symptoms of cicatricial alopecia. So any of you at home, please share this with your hairdressers, with your hair salon, with your barbers. It's https and then it's is.gd/hair loss training. And this will be available on my Instagram, Hair with Dr. Mare, but also maybe you can put it on the CARF website or a link to it, or certainly this video recording will still be there. So please have people do this, because I think the earlier we can get diagnoses and faster recognition, the better. Okay, so into the crux of tonight's talk. So what I'd like to ask of you all is that you get comfortable. And if you're able, because later in the talk, we're going to do sort of a mindfulness exercise, I want you to sit in a quiet space if you can. So let's talk about stress. Yes, stress is a normal part of life. Stress releases powerful neurochemicals and hormones. It's our fight or flight response. Back when we were cavemen and an animal might come to attack us, our stress came on so we could run faster and know to move and sense things more briskly. But this fight or flight response, although it has important evolutionary importance in biology and keeping us safe, when it's prolonged, unmanageable, unexpected, it can have really negative effects on our health. And that's particularly true in people who are predisposed to inflammatory and autoimmune conditions. And patients will always say to me, okay, Dr. Senna, I get it, but like my hair loss is causing me stress. So like, what do I do about this? And it's true, when we look at our LPP and FFA patients at Mass General, and the same is true in our CCCA, folliculitis decalvans, and other cicatricial alopecia, discoid lupus, the average stress scores are very high. And that's particularly true of those who have a more recent diagnosis. Makes sense. You're just learning about this, what is going on. But also, if you have more severe hair loss, right? And so this is something that we really need to pay attention to. So what do we do when we feel stress? We get on Google. We worry about, like, is it in my diet? Maybe I have to go gluten-free. Maybe I have to go autoimmune protocol diet. Maybe I have to do dairy-free. We hide. We drink. We count every hair that falls off of our head. We spend tons and tons of money on things praying that something works. And all of this helps us to create stress. So there are a lot of maladaptive ways of coping with stress: drugs, alcohol, social avoidance, perseverating on negative thoughts, etc. And unfortunately, these things can make us more reactive to further stress. And so the cycle perpetuates. The management of stress is mostly dependent, this is so important to understand, on the ability and willingness of a person, and I would say commitment of a person, to make the changes necessary for a healthy lifestyle. This includes having adequate social support. Studies have shown that meditation and mindfulness can improve health conditions. So let's talk about some of those. In a study from 2018, people with high blood pressure who meditated over an 8-week period had a striking change in 172 genes that regulate inflammation, circadian rhythms, and metabolism. And these changes were associated with a meaningful decrease in patients' blood pressure measurements as well. Their genes were altered from mindfulness and meditation. In psoriasis, excuse me, I just want to put this down so I can see my slides. Up to 70% of people with psoriasis report more severe skin psoriasis when they have emotional stress. I hear this all the time as a dermatologist. There was this trial that took 37 psoriasis patients, and they said, okay, half of you, they had moderate to severe disease, half of you are going to get light treatment, which is a treatment that we use for psoriasis for decades. The other half, we're going to do light treatment, but also listen to a meditation audio recording for 13 weeks. So light alone versus light and a meditation audio recording for 13 weeks. The people with psoriasis who were treated with light therapy and stress reduction cleared their psoriasis faster and more completely than those who did light therapy alone.
It's amazing.
Let's move on to, what's that, Jean?
I said, that's amazing, that that result.
It's amazing. Yeah. It is. And inflammatory bowel disease, another autoimmune condition, and irritable bowel syndrome. So 48 patients enrolled in a 9-week mind-body intervention. They had symptom questionnaires, inflammatory blood markers, and were assessed pre and post-intervention in a short-term follow-up. Their quality of life and symptom severity improved significantly. And again, a reduction in genes associated with the inflammatory response. Their ability to control their stress affected their genes. And so let's look at what they did. So you look back at September 2011, they're having bowel movements 10 times a day, horrible inflammatory bowel disease. In December 2011, they changed their diet. They decreased refined carbohydrates and grains, things known to affect inflammatory bowel disease. Then later, sometime after March 2012, they started this 8-week, 2-hour-a-day mind-body program where they either paid attention to their diet or they did some stress reduction stuff. And they went from this constant urge to stool 9 to 10 times out of intensity, blood seen in their stool twice a week, abdominal pain 5 out of 10 intensity, fatigue. After the program, no urge to stool, abdominal pain resolved, fatigue resolved. So they changed their diet, nothing happened. They added that in and things dramatically changed. Very powerful stuff. There was a larger systematic review of over 20 studies in the literature, the medical literature, on mindfulness that was done. And they showed that while tentative, they were able to replicate the same findings, which is mindfulness, meditation, stress reduction helps reduce inflammation, helps improve good immunity and reduce bad immunity, autoimmunity, and actually even helped improve biological aging. And in alopecia areata, our MGH study of 77 patients, 63% cited stress as an inciting factor for the beginning of their condition and for flares. And we hear all the time from our cicatricial alopecia patients too, that their flares are often incited by stress. This is a common thread. 45% of patients with alopecia areata said who had stress-related disease also had more severe alopecia. So how does this happen? How do we biologically understand that having stress actually affects what's happening at your hair follicle? Well, something called immune privilege is likely part of the story. So what the heck is immune privilege? So this idea was first raised in 1948 when researchers did an experiment on rabbits. They took small pieces of skin from these donor rabbits, shown here in gray, and transplanted them first onto the chests of recipient rabbits, shown here in white. The white rabbit's immune system was like, what in the heck is this? This is not part of us. This piece of skin is from the gray rabbit. Get it out of here. And the immune system came in and attacked that skin on the white rabbit's chest. It was recognized as foreign and attacked, and that piece of skin caused that piece of skin necrosed because of the attack on that piece of skin that was transplanted by that white rabbit's immune system. Similar to what happens to us when we get a fever or a severe illness, right? We feel like crap because our immune system is mounting a response to something that shouldn't be there. Same idea here. But when the gray rabbit's skin was then transplanted to the eye or the brain of white rabbits, the immune system was quiet. There was no attack of the gray rabbit skin by the white rabbit's immune system. In these locations, the transplanted gray rabbit skin remained largely intact. No necrosis, no attack, no inflammation. Oh, I went too far ahead. And so this is what was thought to be due to a natural protective mechanism of the body. The purpose of the mechanism was to prevent immune attack. You could think of it as a shield around certain parts of the body, very specific parts of the body, to prevent immune attack and damage to these vulnerable body sites. So what are the body sites that have immune privilege protection? There are very, very few. Parts of the eye, the brain, parts of the ovaries and testes, the maternal fetal unit when a woman is pregnant, and yes, friends, the hair follicle. So loss of this immune privilege is thought to contribute to a number of conditions, including multiple sclerosis, autoimmune eye disease, also known as uveitis, fetal rejection during pregnancy loss, and yes, inflammatory hair disorders like cicatricial alopecia. So what does immune privilege actually do for the hair follicle normally? Well, the hair follicle immune privilege sends out signals. It says, I'm not dangerous, immune system. Please don't attack me. There are no lymph nodes in the area that can deliver directly immune cells to attack. And then there's collagen elastin, these fibers that are in our skin to keep it like spongy and elastic and supple. And that's a barrier to immune cells getting to the hair follicle. But when there's stress, there's an increased signaling from the nervous system, an increased neurogenic inflammation, meaning inflammation that comes from the nervous system that causes a collapse of those safety signals, that shield. And when that happens, the hair follicle immune privilege collapses and it allows the inflammation to come in and attack the hair follicle. So if we have stress and we have this attack, if we remove the stress, we might be able to remove the inflammation and restore that immune privilege to allow our hair follicles to regrow and to prevent further worsening of cicatricial alopecia. So in trying to figure out the best treatment for scarring hair loss, evaluating the effects of these treatments on stress-induced neurochemicals and their relationship with inflammation is becoming increasingly important. And Dr. Hordinsky and Dr. Rhonda Farah at University of Minnesota have done a lot of work here. And this is just one example. So here on the left side of the screen, you see baseline. So this is before starting a treatment, a patient with cicatricial alopecia. And what you see highlighted in green are all the nerves, so the activity of the nerves. And in red, you see the activity of the blood vessels. And increased activity in both of these things mean increased inflammation, worse disease, okay? After treatment, you see a reduction in the green, a reduction in the red, a reduction in that neurogenic inflammation. And associated with this was an improved clinical response. And so we see this in the tissue, that if you're able to reduce this neurogenic inflammation as part of your treatment, it's incredibly important. And so I am a very big believer that stress reduction should be a part of every treatment regimen. So please bear with me. I think it's important for those of you who are like me and might be a naysayer about, does this really do anything? Like, how am I going to do this? Give me 2 minutes of your time. Be in a quiet place. Sit someplace comfortably now And I'm going to try to do a mindfulness exercise with you. So sit in your chair, making yourself comfortable. Allow your eyes to close gently. Take a few moments to get in touch with the movement of your breath and the sensations in the body. Inhale slowly through the nose with your mouth closed, and exhale slowly through your mouth. First, notice the cool breath as it enters your nose. Notice each time you breathe in, the way the breath feels on your nostrils. When you exhale, notice the warmth of your breath as it leaves. Notice now where the air enters your lungs. Feel the air expand your lungs with each in-breath. Feel your lungs expand and relax. Expand and relax. Notice each breath as a whole now. See how the breath flows like waves. First in, and then a pause, and out, and then a pause. Notice these pauses, these rests between breaths. When you are ready, bring your awareness to physical sensations, especially to the sensations of touch or pressure, where your body makes contact with the chair or armrest. With each exhale, allow yourself to let go and sink a little deeper into the chair or where you are seated. Inhale, exhale. Inhale, exhale. Allow your breath to take you deeper and deeper into relaxation. Pay close attention to your heartbeat as you breathe. Notice how your heartbeat slows as you breathe deeply and relax your muscles. Allow your body to sink deeper and deeper into relaxation. As ideas enter your mind, allow them to float away without attachment. As you continue to breathe deeply, bring your attention to relaxing areas of the body. First, relax your toes and feet. Relax your ankles and your knees. Relax your leg muscles. Keep your breathing deep and relaxing. Relax your fingers and hands. Loosen up your wrists and elbows. Relax your arms and shoulders. Simply breathe as your thoughts come and go. Let go of tension as your body falls into a state of peaceful quiet. Unclench your jaw. Relax your face and let go of your tongue. Watch your thoughts come and go like clouds in the sky. Feel your breath sink lower and lower into your lungs. As your shoulders drop, feel your breath fill the upper part of your chest. You're relaxed and peaceful. Hear the silence grow as your mind hushes. You are relaxed, calm, and centered. Your heart rate and breathing are calm and steady. Enjoy the quiet. When you are ready to return to your day, you can begin to reawaken your body and return to the present. Let your breathing bring you back. Pause a moment. Open your eyes. Feel the goodness of the meditation for a few moments. So it might seem a little bit kooky, but that was 3 to 4 minutes of time where we just separated our mind and our body from all the craziness going on around us. And for those of you who are able to actually do it in a quiet, comfortable place, I hope that despite my lack of expertise in leading mindfulness exercises, that you recognize, those of you who aren't familiar with it, how significant it can be. So let's talk about ways to reduce stress. Social engagement is so important, and that is one thing we are all desperately needing at this time.
Mhm.
But if it's Zoom parties or chats with friends or reaching out through people from car for, you know, just like watching a movie with your kids or your husband, or a TV show, you know, also important. There are these silly like adult coloring books on Amazon that I was like, oh, come on. And then someone got me one for Mother's Day, not this year, but last year. And I found myself like doing it, and it's actually amazing. Like as you're coloring, your mind just automatically goes off of anything that you're worrying about. So for those of you who might be inclined to do that, it's something that can be helpful.
Hey,
Stress
Maryanne,
reduction is different for all of us. Some of us, yeah.
I found something on Amazon during this quarantine that has helped me reduce a lot of my stress and anxiety, and it's adult paint by numbers, and there's some really cool little paintings that you can
Yes.
get. And you know, it's really, it kind of just takes your mind off of all the craziness, and you just kind of focus and you get into a zone and you're creating something. So it actually makes you feel really at ease and at peace with yourself. It's really great. Painting by numbers. It's an adult thing.
Love that. Yes, 100%. Great recommendation. And I think the other thing, at least for people who are type A like me, I think beginning something and ending something is also very good for stress, right? Like you have a piece of paper and you're coloring it and you finish it. You have a painting that you're doing and you finish it. There's a dishwasher to be unpacked and you finish doing that. There's so many tasks that create stress for us that we start but we can't complete. And so I think that being able to start and complete things like that can also be very sort of soothing for us. Great suggestion, Jean. But you know, not exercise isn't for everyone. So you can exercise your mind, but exercise your body as well. So many people might not know this, but the Peloton app has a free 90-day trial now during coronavirus stuff. And it's not, you don't need a Peloton bike. I don't have a Peloton bike, but you can do outdoor runs, outdoor walks. They have yoga, they have meditation, they have other exercises, they have stretching. It's been fantastic. And so something else you can think about doing. And then there's all these like great apps online, and most of them have a lot of free content. You can get subscriptions if you want to, but they have like 5-minute meditations, 10-minute meditations. They have like the hour-long meditations and the half-an-hour-long meditations. But for most of us who are pulled in so many different directions, they're very attainable, I think, as goals. To even if you do it like 2 or 3 times a week, I think it can be really helpful. They also have apps, or I should say meditation things where you can do them right before you're going to bed. So if you're a person who, you know, all the things throughout the day are jogging through your mind and like you're stressed out right before bed because it's your only quiet time, they have apps for that too that can just kind of chill you out before it's time to sleep and allow you to have more restful sleep. So whatever works for you, it might be dancing in your kitchen to music or whatever. You need to find something that works for you.
I actually just put the app Calm on my phone, and I found it to be awesome. And you're right, they have so many different variations. And even if you have a minute, 2 minutes just to break away from your day, and you throw some headphones in and you just kind of you ground yourself again, it is so relieving. And when you go back to what you were doing, you feel a little energy and refreshed, and it really does reduce the stress. I highly encourage people to try it.
It's so true. So, going back to this situation, I did telemedicine from 8 a.m. until 5 p.m. I wanted to allow extra time to prepare for this, even though I had prepared earlier in the week. And yesterday, I wanted to make sure like I had everything set up. I had to feed my kids. I had to throw in a load of laundry. I was like, oh my God, like what is going on? I was feeling really stressed. And I was like, I don't feel like exercising. Like I'm not going to get all sweaty and shower in time for this presentation tonight. I didn't feel like I wanted to do a Calm app. You know what I did? This is what I did. Truly. I went outside in my yard and I looked up at the sky. It sounds kooky, but I will tell you, getting some fresh air, getting away from the noise, just looking up at the sky and taking some deep breaths. It took all of 5 minutes, and I came back into that house as a new person. And so I guess what I want to encourage all of you to do is find whatever works for you. It doesn't have to be a major commitment. It just needs to be a consistent thing that you do, even for 5 minutes or 2 minutes a day, where as part of your self-care, you just ground yourself and take a deep breath and go on. And so if going outside up at the sky is what you have, work for me tonight. So just another thing. Thank you so much. I feel like it is such a privilege to be able to talk to you all. I love this group. I think you're fantastic. The patients, Jean, Colleen, Mike, who does this for us, all like amazing, committed people. And I'm grateful to be a part of it. So I'm happy to take any questions that people might have. Thank you.
No, we love you too, Dr. Senna. You're an amazing advocate for us and so helpful on so many different levels for this organization, and I can't thank you enough. So again, thanks for doing this with us tonight. And I know that there's been a little bit of a connection issue. So at some points during Dr. Senna's presentation, it may have been a little bit of a delay, but I think we've kind of gotten over that now, and we're ready to address some of the questions. We were able to post some things out today, so we did get questions from our members prior to tonight's meeting, so I'm going to share them with you now. You'll be able to see them on your screen. So Dr. Senna, has there been any new evidence showing that the use of PRP treatment can benefit lichen planopilaris?
So it's a great question. This is what I can tell you. Lichen planopilaris, any cicatricial alopecia, will not be made worse by PRP. If PRP was free, I would do it for everybody. It is not free. It is actually incredibly expensive. As an adjunct treatment to a really good regimen of anti-inflammatory treatment, it can help. But PRP alone is not going to take care of any type of primary cicatricial alopecia. And so people need to think long and hard about where they're putting their dollars and what they're doing. Yeah, I mean, most people who have cicatricial alopecia will also have some degree of natural hair thinning that happens to all of us with every decade of life, and certainly after menopause. And PRP will help boost the hair thickness and help boost some coverage in that way. Okay. But it's not going to cure LPP or other primary cicatricial alopecias.
Okay, thank you. Thank you. The next question. LPP was exasperated with the move. A dime size has gotten so much worse. I do injections, doxycycline, Rogaine, clobetasol, and took Plaquenil. Nothing works. Can it be the environment?
So that's a really good question. I am a firm believer, and this might not be shared by all of my colleagues. I think a lot of them feel this way, but I do think that there are a lot of potential allergens and other things in our environment that definitely play a role in exacerbating or maybe even contributing to cicatricial alopecia. And Jean, I'd love to do another whole segment on this at some point in the future, because I think it's really important. That's why something like Scene, the shampoo and conditioner, the fragrance-free formula is so good, because there are things in our shampoos, our conditioners, our things that we use all the time that definitely can make things worse. Stress can make things worse. The other mistake that I see patients making a lot is that they don't give any one treatment enough time to work. And unless you are monitoring patients in a very systematic way, how much redness do they have? How much scale do they have? Grading that, doing measurements, taking photographs, you really don't see these small changes over time. And so I think that most treatments for hair loss, you need to give them consistently 6 to 8 months to see if they work before you say they don't work. And I see a lot of patients who said, oh, I tried this for a month and it didn't do anything. It's not going to do anything in a month. And so giving things enough time and having important.
Why is that? Yeah. What is the reasoning for that? What does the drug have to do? Why does it take a time to build up or to have the effectiveness that you're looking for?
So in the simplest of ways, I can explain it like you have eczema on the skin, you have psoriasis on the skin, you have some sort of rash. That's very superficial. You can put a cream on it and you can see that anti-inflammatory effect taking effect right away. The rash goes away.
Mm-hmm. Okay.
The hair is very, very different. The penetration to the hair follicle, the changes that happen lower down in the hair follicle that then need to then move to what you actually see as the hair is growing, and then the hair only grows a centimeter a month, that takes a much longer period of time.
Okay,
it doesn't happen.
That makes sense. Okay, that I was always wondering that. Okay. All right, our next question. I noticed that itching and discomfort increase at night. I do not notice scalp discomfort during the day. Is this normal? And how does the itching and burning sensations relate to stress?
My goodness, if I had $1 for every time I heard a patient say this, I would have paid off my medical school loans, and I use this joke very sparingly, but that's a big number, okay? This is the reason why. During the day, we're distracted. We have a million other things going on. It's not just hair stuff, any rash, any itch. You're less distracted at night. You're trying to fall asleep. There's nothing else going on. You're trying to just end your day and go to bed. And so things like itch are going to creep up and seem much more pronounced because of the lack of distraction. It's a very common complaint across the board in all things that cause itch.
Okay, that makes a lot of sense too. Our next question is going to be, living in this time of COVID and working from home and uncertainty about when or if life will get back to normal, I find my anxiety and my depression is kicking in. It's also exacerbated by my FFA symptoms, primarily with scalp itching. How can I best manage my emotional well-being to the point it benefits my physical well-being with FFA?
Well, first, I just want to say, whoever sent in that question, I feel you 150%. And I think that the vast majority of people, if not everyone listening, feels that way, because this is a horrible time and no one's ever experienced anything like this before. And it's incredibly hard. And we all have our own challenges and our own pains that we're going through right now. So you're not alone there. We all have these feelings. I hope that the talk tonight, if you were able to watch it, explained some ways that increased stress can affect inflammation. And I hope that I was able to convince you about small ways that mindfulness, or just taking a break, or giving yourself a break, really, it's all about giving ourselves a break, can really be impactful in helping things like that. And I think we're all often too hard on ourselves. We try to do it all, and we need to give ourselves a break, especially now.
And this is a great time for you to turn to CARF, especially because if you are affected and you know, this time is it's affecting all of us in so many different ways, but there's a community out there that are of other patients that are going through the same thing you're going through. And even just, a friendly email, or we can, a quick chat, we can connect you to other patients and reach out to us. Those of you who are feeling kind of down and out, that's what we're here for. Let's connect everybody and so we can uplift one another and get over this hump, because you're not alone and you're not out there by yourself dealing with this.
Yeah, and the other thing is too, like, people are trying to be positive on social media and post like, oh, look at how that, but everyone's feeling it. Everyone's miserable. Anyone who's a real friend, if you talk to them, they're like, I'm all right. I'm not that good. Do you really want to know how I am? Right? Is anyone doing that well right now? No.
Mm-hmm.
So
Mm-hmm.
be kind to yourself.
Yeah,
Seek
exactly.
support where you can find it, like Clark and other places.
So our next question is, I'm embarrassed and ashamed by my hair loss. I work as a flight attendant and I feel very ugly and self-conscious. I had a gorgeous full head of hair, and while I'm able to hide my bald spot now, I don't know how much longer I can do so. How can one get over being so self-conscious? So common.
That's a really hard one. I mean, I am 44. And I think I see it all the time in my patients and my friends. I feel like women especially, we could be so hard on ourselves because so much of our identity is linked to what culturally and what society wants us to be, like some, Giselle supermodel, and that's just not realistic. But certainly when you have something like hair that you're proud of, or whatever it is, a fit body or whatever it is, and then time takes its toll or health takes its toll and things happen. It's very hard when that piece of you is such a part of your identity to kind of let it go. I don't have any great words of wisdom. If I did, I think I would be dealing with stuff better myself. But I will say that the one thing I can say, and I hope it brings some solace, is, now I have photo documented evidence of over 7 years in Mass General, where I take the same photos and the same measurements and the same grading of all my patients, and with very few exceptions that I can probably count on one hand, the vast majority of my patients are stable to improved after being in my care for 7 years. And I'm sure my other colleagues would say the same thing. It's scary. Mm-hmm. It's horrible to think about what's next. But if you're consistent with treatment and you have the right treatment and you're doing your stress reduction, you don't have to fear this crazy unknown that you're going to go bald or that things are going to get so much worse. That we have enough treatments now, and we're trying to gain understanding, and that's where your support comes in, please, to learn more about these conditions and figure out ways that we can continue to halt this disease and even make it better. And so I don't know. I don't know about the self-confidence thing. I think it just comes down to self-love. I really do. And just recognizing that our value is more than quote unquote skin deep. We have much more value to us than other things. And we are always our hardest critics. What we recognize about ourselves, other people aren't even noticing them. So keep that in mind too.
It's a good advice. Yes, good advice. So is it possible for scarring alopecia to burn itself out and stop? And if the scarred part of the scalp will never regrow hair, and the rest has a lifetime for each strand, will I lose it all as I lose each piece that does not grow back?
Wait, let me read this. And if the scarred part of scalp will never regrow hair, and the rest has a lifetime each strand, will I lose it all as I lose each piece that does not grow back? So I'm not sure if I'm fully understanding the question, but basically, yeah, this absolutely can burn itself out. And it's very unpredictable as far as when that happens and if it happens, and if you have to stay on treatment or if you can go off of treatment or how long you have to be on treatment. What I say to my patients is, listen, if you're starting a treatment regimen, you're on this treatment regimen for minimum of 2 to 5 years, depending on your severity at presentation. And you have to commit to that. We got to squelch the inflammation. We got to get it under control. And then if that happens, which most often it does, and we see that things are quiet, then we can start to think about either pulling off treatment or saying, okay, this is dormant. Now, there are definitely some people where the disease will just arrest itself. It'll just, as quickly as it came on, it goes away. And part of me wonders, was there an exposure that they were coming in contact with that was aggravating them? Was it something else? We just don't know. We're doing studies now to try to understand that better. But the bottom line is it's very unpredictable. And I would say that the longer period of time that you have no activity and you have stable hair loss, meaning that if it's a scarred area, it stays that same area of scarred, it's not expanding, etc. And there are no signs of active inflammation, that redness, that scale, the symptoms of itching and burning. The longer period of time you have without those, the more likely you are to sort of be in a safe zone. And to be able to start thinking about things like maybe we transplant hair here. Maybe, we're in a point where we don't have to worry about this moving. But that doesn't mean you go off the grid. I still tell my patients who are like this, I need to see you every 6 months or 1 year to make sure that with my magnification, I continue to see no evidence of inflammation, and check in with you to make sure that if something were to come up again, we nip it in the bud. So I don't know if I answered the question, but that's sort of how I think about it.
Okay, that's a good answer. So I would like to know if my hair will grow back by using vitamins, different oils that cause the hair to grow, etc. Also eating certain foods that aid in hair growth.
Listen, if it was that easy, and I tend to be like a person who likes to approach things holistically, like what can we do ourselves to fix something? I think the main thing that people can do to make cicatricial alopecia better is avoid potential allergens and products that they're putting on their head and neck. And like I said, Jean, I can do a whole thing on this, but the bottom line is I have not seen in my patients, and I see a ton of cicatricial alopecia patients, okay, that diet makes a difference, unless you're a patient with celiac disease. Guess what? You have celiac disease, you have inflammatory bowel disease, you have diarrhea every time you eat something. That inflammation is probably not great for any other inflammation going on. But outside of those few cases, diet is not going to make a whole lot of difference, assuming that you have a well-balanced, healthy diet. You're not drinking, sugary drinks and eating white bread and having what we call a high glycemic index diet, right? Things that bump your blood sugar and then make it crash. So if there's one thing you might think about doing for any inflammatory problem, it's looking at a low glycemic index diet. I think that is just a good health thing to do, period. But as far as vitamins, nothing. As far as oils, nothing. I don't know of any data that shows that. If I learn differently, I'll be the first to tell you. But there's a lot of stuff on the internet, and I think a lot of it is misinformation. And until we see better data, it's hard to know. I do know that Crystal Aga at Johns Hopkins thinks that certain essential oils, at least for CCCA, can be helpful. She might be a good person to ask this. She has a lot more experience with that. In my own experience with cicatricial alopecias across the board, I haven't seen any major benefit. So in general, it's not something that I recommend.
And when you're saying see a major benefit in hair regrowth, is what you're referring to,
or in halting inflammation, or in halting. So when I'm talking about a major help, when I say that, I mean halting worsening of disease, 1, and 2, regrowth, right? Okay. Either one of those things.
Okay. Next question. What are some of the measurable or anecdotal results you have seen in patients with cicatricial alopecia after using meditation or mindfulness techniques? That's a good question.
Huge. They feel better. they do better, they respond to medications better. I mean, listen, it's not just gonna help your hair, it helps everything. It sounds kooky, it sounds, you know, like earthy crunchy. My sister's like, I'm the oldest of three girls, my youngest sister is a tree hugger, we always make fun of her. But you know, I was a big skeptic, but let me tell you, it makes a big difference. And I think the more stressors that you have and the more that's weighing on you and the harder it is for you to find quiet time, making that quiet time becomes imperative. And it absolutely makes a difference in how people do clinically, 100%.
Mm-hmm. Mm-hmm. Yeah, and I often find, even with the breathing that you were talking about, you know, even if you're in a busy, crazy day, even if you're in your car or you're sitting, sometimes people don't even know that you're doing it. You could be sitting in a meeting and somebody's, you know, in a lecture, and you just want to kind of bring yourself back. You can do that breathing just wherever you are and what you're sitting, and just give it 3 to 4 minutes, and it really can make a difference and bring you back down. So
thank you for bringing it up, Jean. You're so right. Like, there are times when, like, you know, I drop my kids off at school, I race to work, and I just put on a timer for 3 minutes in my car, and I just sit by myself, and I just take deep breaths, and it makes a world of difference. I feel like a different person walking in the room. And it, you know, yep, that, or like if you're in a waiting room, waiting for a doctor or waiting for your dentist or whatever it is, those are moments that you can take advantage of that otherwise would be wasted, that you can use to your advantage potentially.
And nobody even has to know you're doing it. You know, like, it's such a private moment for yourself. Like, you could be doing this, which is, you know, you don't even know that, like, I'm totally, you know, in the Zen right now, but they have no idea. Yeah.
Yeah.
All right.
And
So
like, you could have like a picture on your phone and just zone out and look at it, and people think you're just looking at your phone like everybody else.
Exactly. Right. Right. Okay, we got 2 more questions. A second and last question. Do you recommend any supplements to help our bodies better deal with stress? I'm anxiety prone and could use natural solutions to better mitigate stress.
Yeah, so there's some data. It's a really good question. You know, I don't know if it's the full solution for everybody, but there is a lot of data on omega-3 or omega fatty acids. I think it's 3 and 9 being really helpful for anxiety and depression. And the exact dosages, I don't have my finger on. I can certainly find them, and we can send them out in the next newsletter or something, Jean. But omega fatty acids can be really helpful in things like this. If there's one thing that people want to try to do naturally to boost or their mood or help their propensity towards anxiety and depression, that is one thing that has been shown to be helpful.
Okay, and just to dovetail onto that, what do you know about CBD oil? That seems to be all the rage. People are taking CBD oil, and I know that that's kind of what its mantra is to calm people down and reduce anxiety. Have you seen anything about that?
Yeah, so, you know, I think that my gut is like, probably ingested orally or something, it could probably be helpful. I'm a little bit more skeptical about how well it works topically. Again, this is not something I've tried myself. It's not something that I have a ton of experience with, so I might change my tune on it. Right now, it's not something I'm routinely like recommending. Again, that might change with more, you know, experience. It makes sense that it might help. I don't think it's going to harm, certainly. It's just hard to know how much it will help until we have a little bit more data.
Understand. All right, our last question. What are your thoughts on leaky gut contributing to scarring alopecia?
So a lot of this stems from like our understanding of the microbiome and healthy flora in the gut, and how having a healthy gut flora might affect things like cicatricial alopecia. And if I'm not mistaken, Angela Cristiano, who is like a genius at NYU, she did a study specifically in cicatricial alopecia where she looked at the levels of the skin microbiome in patients with LPP and FFA, and I think CCCA. I think it was like a number of different primary cicatricial alopecias versus controls. She also did that for the gut microbiome. And between primary cicatricial alopecia patients and controls, meaning patients who don't have primary cicatricial alopecia, there were no differences in the skin microbiome or the gut microbiome. And so my understanding from her research is that it probably doesn't play a big role. I do think, though, that people who have significant GI issues can have malabsorption, can have low-level inflammation that probably isn't helpful. And so whether it's diet or other ways of managing that, I do think it's important. Interestingly, in alopecia areata, which is an inflammatory hair loss condition, that does not cause scarring, it's non-scarring. There, she did find a difference, I believe, in the gut microbiome, where there were certain types of bacteria that were different in alopecia areata patients versus people without alopecia areata. But that did not seem to hold true for primary cicatricial alopecia.
Okay. All right. Well, there we have it, everybody. Dr. Senna and her hour-long time and dedication to our community, answering your questions and providing that exercise for us to really kind of, get into ourselves and bring out some of the anxiety and stress and bring it down to a level where it's manageable and you can kind of be very mindful of your body. Data obviously shows that stress is something that is definitely a factor in our world today, and that this mindfulness and meditation and all these exercises really can help improve your health overall, in addition to your scarring alopecia. So, Dr. Senna, thank you so very much.
Club. Please join so I can be with you guys on an intimate Q&A. I have so much more I want to say. It's so hard to do it. I want to answer your personal questions and really get to the nitty-gritty of things. So please join, please contribute. Let's do this together.
Yeah, absolutely. Thank you. And thank you again to Scene Hair Care for their support of tonight's webinar. We're greatly appreciative. And we will be hosting our next webinar next month. You'll see a lot of information on that coming out soon. And that's a wrap. This video will be available on our website. For those who were not able to join us tonight, you can watch it at your leisure in the coming days. So, all right. Thank you, everyone. Take care. I look forward to having at least 30 of you signing up tonight for GEMS. When I wake up tomorrow morning, I'm going to open up my email, and there's going to be a whole list of names in there. Thank you, thank you, thank you. Let's keep it going. CARF is on a major trajectory upward. Let's go. Okay, take care.
Let's do this, guys. Come on, enough is enough.